Hello, my name is Patty Weiser, and I work in the ICU at Frederick West Bend Hospital. Frederick West Bend Hospital and Frederick Menominee Falls Hospital have been combined to form the Community Health Division, otherwise known as the CHD. Today I will be talking about nurse certification in the CHD. The stakeholders are the leaders, educators, staff, and ultimately patients. However, this presentation is focused on nurses to explain why certification is important, why rates have been traditionally low, and how we can use our voice as a positive influence to change. This problem will be reframed in order to revitalize the change initiative. The point of this Ed Talk is to empower nurses with this shared vision. I would like to start by sharing this inspiring quote by Steve Jobs. Your work is going to fill a large part of your life, and the only way to be truly satisfied is to do what you believe is great work. The only way to do great work is to love what you do. RN licensure measures entry-level competence. Certification validates specialty knowledge, experience, and clinical judgment. The first specialty nursing certification was established in the U.S. in 1945. There are more than 180 specialty certification options for nurses. Certification validates advanced knowledge in a specialty. This has a positive effect on quality of patient care and shows value to healthcare stakeholders. It has been reported to decrease nursing turnover and vacancy rates and also increases patient satisfaction scores. So why is there a low certification rate in the Community Health Division? Why would nurses not want to achieve this personal success that would result in better patient outcomes? Florence Nightingale said, "I attribute my success to this. I never gave nor took any excuse." Currently, about 16% of the nurses in the CHD are certified. There are multiple reasons for this low rate, and leaders want this rate to increase. Increased certification is currently on the 2020 strategic goals and is listed as a necessary component as we start a journey toward magnet designation. In order to move forward in this transformation, we must look at why certification has had low rates. Certification as a priority. Historically, nurses pursued certification as more of an intrinsic goal. The nurse would decide on her own that she wanted to be certified. She would study on her own time, and there was minimal support for her. There was a cost factor and a fear of failure. The benefit to certification was not clearly defined or seen as a priority. There's another quote that came to mind when we were talking about creating a powerful guiding coalition. The bamboo that bends is stronger than the oak that resists. There was not a united effort of leaders and educators with the nursing staff. And of course, there was resistance from staff due to the barriers. So one way to deal with resistance is to give the work back to the nurses so that they can help decide how we should go forward and work on increasing nurse certification. There also needs to be a vision. We need to have a clear vision about certification and how we get there. There also needs to be communication. The vision needs to be explained loud and clear to staff. Leaders were on the balcony and observed that nursing needed to be involved in the area of shared governance. This past year, we did make a poster board with information about certification. This contained resources and places on the internet where you could find more information about certification. Questions were answered, and there were some staff that did seem interested. However, there needs to be further action. There were obstacles to this new vision. Barriers were identified by nurses and were not provided with solutions. The voice of the bedside nurse needed to be heard. Short-term wins needed to be celebrated also. Increased nurse certification was identified on the strategic map, as I had mentioned earlier, but there weren't specific numbers or a process for how it was tracked. We needed to recognize and celebrate nurses when they were certified. Every year we should be looking at the nurses that are certified and celebrate when a nurse is newly certified. As nurse certification increases, we need to promote and celebrate each other in ways such as luncheons and peer recognition and manager recognition. Recognition by our leaders and peers is important to sustain and encourage each other. Nurses should use their voices to determine what type of recognition is valued to them. One option that we can do is a survey monkey. The Image Council has done a survey monkey in the past to find out what type of recognition is important to nurses. Of course, you're going to have different opinions on that, but we can try to get as many different types of recognition as possible. Certification needs to be anchored in our culture. We need to be transparent as far as our goals and the process of how we're going to increase our nurse certification. We need to realize the value of certification, and we also need leader and educator support. Maybe even more importantly is that we need peer support. We need to support each other in this process. Nurses that have been certified and understand the process and know what it's like to study for an exam can offer support to their fellow nurses. Helen Keller said, "Alone we can do so little, together we can do so much." So what are some of the barriers that have traditionally been involved with nurse certification? Time, of course. We are all very busy at work. We put in a lot of hours being bedside nurses, leaders. We do educational commitments. We have a lot of committees and things that we're on. Many of us are in school pursuing furthering degrees such as BSN, MSNs, and even more than that. The cost, of course, is also of concern. There are costs associated with review classes, there's costs associated with the exam itself, and of course there's fear of failure. If we don't pass that test, we may not get reimbursed if it's a certain type of certification. Many people also have test anxiety, and so this is not something that they're interested in. And the last barrier that's important to people is a lack of support. They really maybe don't feel that they have support from their leaders or their peers. How do we break through these barriers? There are intrinsic values and extrinsic values. The literature states that certified nurses as a group placed higher values on certification than those who weren't certified. Intrinsic values are more challenging to influence. Certified nurses believe that they make decisions with greater confidence. They experience personal growth and feel more satisfied at work. They are less likely to change jobs. But we really do also need to focus on extrinsic values. This can be done through leader and organization recognition. Currently, nurses who become certified have varying types of recognition. Some departments have a plaque to display their names. Leaders may send out thank you emails. They may be recognized around Certified Nurses Day in March. In the past, the Image Council made homemade cards to be given out to the certified nurses. There were in excess of 250 certified nurses at that time. Extrinsic recognition could include professional recognition, peer acknowledgement, pins, a small ceremony, a small gift, or maybe even perhaps a luncheon. The main barrier to achieving certification was time. The organization can provide flexible schedules, possibly having paid study time, offering review courses if available. Educators can assist by recommending study habits, study materials, and practice test exams. Nurses who are certified can also provide peer support to others who are preparing to take the exam, maybe giving them tips along the way, even if it's just encouragement. Exam cost was also a large barrier. In the past, the organization has provided reimbursement only if you passed, and in some certifications that is still true. The change would allow for programs such as more use of the fail-safe certification program, which pays for the exam cost and allows you to take the exam twice in 1 year. The benefits of these programs includes decreasing nurse test taking anxiety and removes the burden of the exam cost up front. Educators and leaders can give the work back to staff by allowing them to be creative in the solutions. Transformational leadership can really lead to positive outcomes. Staff will be more motivated, engaged, and have positive attitudes. Staff can also experience less stress and perform at higher than expected levels. So we need to talk about, what is your why? Why would you want to be motivated? Why would you want to be certified? Why would you want to take the time and the effort to take the test and join the ranks of certified nurses? Idealized influence. So the first step in idealized influence is becoming a strong role model ourselves. So even though we may not have an official role as a leader, we are all leaders at the bedside. We need to all work hard and set good examples, act ethically, and emphasize a common mission. Inspirational motivation. The first step has been implemented to briefly educate staff on the goal of magnet designation and the need for increased certification. Poster boards, as mentioned earlier, were at the skills fair. We also talked about the need to increase certifications at shared governance councils. Managers have collected information on who is certified and what that certification is, and the numbers are in. Managers were given this information and now know how many of their nurses are certified, and units have been identified where a little more work needs to be done to increase numbers. Flyers have recently been posted on the units to explain how to have the cost covered. Review courses have also been offered to RNs, and links to certification sites have been posted on the nursing website. So we need to remember, what motivates you? Intellectual stimulation. Leaders and educators can assist staff by supporting them with information on how to become certified. These can be different ways, such as emails, social media at work, such as Workplace, and flyers on the unit. Shared governance is an extremely strong and influential group of nurses, including bedside nurses, educators, and leaders, that can assist with this transformation. Bedside nurses know what the barriers are and what solutions will work. Management needs to let bedside nurses be creative and find out ways to support themselves and each other in the certification process. Study groups can also be formed, and staff, once again, can give peer support. We also need to remember to allow for some mistakes. Individualized consideration. Leaders will track the nurses who become certified. Data will be monitored to see if this increased support will result in higher certified nurses. We anticipate that increased leader and educator support will result in higher numbers of certified nurses over the next few years. Currently, the goal is about a 1% increase per year. If that doesn't happen, we will need to reevaluate the plan. We will also have to look at unintended consequences, surprises, successes, and possibly failures. Based on what was learned from the change, we may need to adapt or modify some changes after the first year. So what we do is we would like to encourage all of the nurses to think about their why and what their motivation is, and how they might go about looking into nurse certification. It is a team process, a team effort of leaders, educators, and RNs all working together to give positive, improved, high-quality outcomes for our patients.